Hi, I'm Dr. Gary Sachs, and I'm here with Theresa Schmidt, nutritional therapist. And we thought that with Valentine's Day coming up, we might talk about the heart and what causes heart problems.
Yeah. So many people, they've just honed in on cholesterol being the problem,
Mm-hmm.
and the total focus of everything is on cholesterol. You know, is your cholesterol 240? Is it 180? Is it 160? Those are just crazy stuff right now.
Yeah.
So and that's what it used to be. It used to be 240 was fine. And then
Mm-hmm.
220, and then 200, and then 180. And I have some people come in and say, my doctor wants me to be around 160. And
I have some at 150.
it's dangerous.
It is very dangerous. Yeah.
That is dangerous. So I just want to do a little bit of clearing about that. Cholesterol is not our enemy.
Mm-hmm.
Cholesterol is our friend. And if there is higher cholesterol in the bloodstream, that means the liver has sent it out to fix something. It means there's inflammation someplace in the body.
Because people think it's all about the cholesterol they're eating.
Yeah.
Rather than what the body's making,
Right.
and that's reversed.
Right.
Yeah.
Right. Your body will use or get rid of cholesterol it doesn't need,
Mm-hmm.
but we recycle it because we do need it. We need to
Yeah.
store it, and it's stored in the liver, and it's released when the liver gets the signal that there's inflammation someplace in the body. So if there's cholesterol in your bloodstream, like regular old cholesterol, it's because you're trying to fix something. So you don't want to negate the fixer.
Mm-hmm.
You don't want to stop your body's ability to fix itself. And when you do that, when you just focus on that, you ignore what's causing the inflammation in the first place. So that's the part that I feel like gets missed a lot when they talk about the cholesterol. It's like, why are you putting cholesterol out there in the first place? So it's the inflammation.
Yeah.
Yeah.
I was thinking, throughout the years, people have developed various tests to evaluate the strength of the heart, the health of the heart, the strength and health of the blood vessels.
Mm-hmm.
And they're all very valid, but none of them are paid any attention to. And I believe, this is my belief, the reason is there are no medications that can address all of those other findings. Mm-hmm. Somebody came up with a medication to address cholesterol, and that's utilized, in that way. Mm-hmm. But the amount, the need for vitamin E, or being particularly low in vitamin E2, has been documented as a critical factor. Mm-hmm. But what interferes with our ability to make, or I guess synthesize, get vitamin E from the things that we eat? There's no drug for that.
Right.
So it comes to different types of testing, and I wanted to bring this into it because way back, Dr. Lee, that founded Standard Process, developed a type of equipment that would measure the 4 chambers of the heart in relation to each other and was able to determine what are the specific needs according to how those are functioning to each other. Mm-hmm. It's a great tool.
Oh yeah, it's an excellent tool. And I would say, and I think reading about, because we like to read a little bit about like how he came up with this and what his thought process was about it and things like that. So where are we getting off on things? Where are we running into trouble is with like synthetic food.
Mm-hmm.
Because the synthetic vitamins and things in there block our ability to utilize the real vitamins. Right. So it actually gets in the way. Processed food gets in the way of our heart functioning. One of the biggest causes of AFib is processed food.
Yeah.
Yeah.
And it's, there's so much we could talk about with this, because the lifestyle that most Americans are living in is very fast-paced. They're always looking for a faster, easier way to do things. So we have fast food, we have packaged food, and all these things are very highly processed. And it is true, to be healthy, you're probably going to have to take a little more time into putting that into what you put inside this body.
Exactly. And we also have to be careful because we all know that a lot of people eat like that. So then they know, we're supposed to take vitamin E, right?
Mhm.
We're supposed to take vitamin D in the wintertime. We if we don't eat our colors, we should take vitamin C. But the problem is there's good vitamin C and there's bad vitamin C. And so the synthetics again, it doesn't do you any good to take a synthetic to fix something that's not working right in the body, because it just blocks it all the more. So understanding the difference between a real whole food vitamin and a synthetic is really important before we go ahead and try to buy that kind of stuff too. So that's one big area. The other area that I like to address is, because everybody kind of does focus on cholesterol, when really the struggle with the heart is a big part of it anyway, not the whole thing, but a big part of it is that what we eat gives off different toxins, and how our body and our heart and our muscles respond to that has to do with everything.
Yeah.
So we were talking about this earlier. When we eat a carbohydrate, we give off lactic acid. That's what we give off when we process that. When we eat a good fat, which we make 18 times exponentially energy out of,
right,
than a carbohydrate, we give off phytic acid. And the heart can handle phytic acid. The liver can handle processing phytic acid. The heart and the liver cannot get rid of lactic acid. So if you build up enough lactic acid in the heart, it's going to cramp, and you're going to have a heart attack.
Yep.
So,
just like any other muscle.
Yeah, exactly.
In the body.
Exactly. Except like the thigh muscle can get rid of lactic acid, the heart can't.
Yeah,
so
I just meant it cramps when there's too much lactic.
Cramp.
Yeah,
exactly.
Yeah.
So what we eat matters. It's not just, when I talk to people about not eating grains and not eating potato chips and things like that, it's not just because I'm mean. It's because I'm trying to protect, like right down to the heart, we're trying to protect that so that body can take care of itself.
I don't think anybody could think you're mean. So.
Some people do. Oh.
Might seem like that, when you're
Yeah.
But for so many people, it surprises me, but it's like a foreign thing to sit and say, I'm going to make a salad. I'm going to do this, because it takes so time, and I could just slap together a sandwich and,
I could drive through.
Yeah.
And for $1.50, I can get this and that. For $1.50, I can get that, and I'll be satisfied. Good grief.
Yeah.
It's just so
you're getting what you paid for.
Yeah. Yeah.
For sure.
Yeah.
So, well, these are some thoughts about the heart, and there's much, much more. If there's any specific question you have, feel free to reach out to us. You can reach us through our website, www.sexwellnesscenter.com, or give us a call, 989-732-7000.